Welcome everybody to this fitness center lunch and learns. I'd like to introduce Dr. David Kravchuk. He's a doctor of Oriental medicine and licensed acupuncturist. He has been practicing acupuncture, her- herbology, and nutrition for over 30 years in Battle Creek and Kalamazoo. Dr. Kravchuk, I really appreciate you being with us, and
Mhm.
we look forward to all the information you will give us. Thank you.
Okay. All right. Thank you. Um, yeah. So I've been doing acupuncture for over 30 years, and right now we're in Battle Creek in Kalamazoo. And I first got interested in acupuncture after I was treated myself for my diabetes back in 1971. I was diagnosed, and my dad, who's an MD, he sent me to uh, actually one of its classmates. So I got started on insulin, and I did okay for a few years. But then after a few years, I started, having real brittle diabetes. My blood sugar would go up to 400, and at one point, maybe once a week, I'd wake up and I was in an emergency room. Back then, you couldn't just check your blood. With the finger stick. So you had to check your urine, and that would tell you what your blood sugar was a couple hours ago. So I was having a lot of problems, and like I said, once a week I'd wake up, I'd be in an emergency room, and so my dad, who was an MD, he sent me to 5 different MDs who specialize in treating diabetes, and it just wasn't helping. So when my friend said, "Well, why don't you try acupuncture?" I thought, what's that going to do for diabetes? And I said, okay, well, what the standard thing's not working, so I got nothing to lose. So within about 6 treatments, I was having to use over 100 units of insulin a day. And within 6 treatments, I started feeling better and so I only needed about 35 units a day. And I didn't have those reactions like that. And it's a whole lot safer for myself and other people around me too. So anyway, that got my interest going. And yeah, I went to the California Acupuncture College and finished my internship in China. And yeah, and learning one of the techniques we use a lot at our clinic is the NAET. It stands for Nambudripad Allergy Elimination Technique. And Dr. Devi, who was allergic to most foods except for white rice and broccoli for most of her life. She became an RN, and then she became a chiropractor, and then she was going to acupuncture school, and she'd had like a real bad reaction to a carrot, and she found, she gave herself a treatment, and when she woke up, she found out that she was laying on the carrot, but she knew how to muscle test herself, and she discovered that she was no longer allergic to the carrot. And so her idea was that if you're completely rebalance the body while you're in contact with the allergen, your body no longer sees it as an allergen. It responds properly to it. So she developed a whole system, and it's been used worldwide. And um, now her son, who had some learning disabilities, and she treated him, and now he's an MD and he's taking over the organization. So yeah, it seems to work really good for allergies, but also autoimmune diseases are basically allergies too. So we do quite a bit of work with that, and actually treating quite a few Lyme patients, people with Lyme disease. Um,
Um, Dr.
and
Kravchuk,
yeah, uh-huh,
we have a we have a
question,
question. Is it
uh-huh,
possible to clarify type 1 or type 2 diabetes? The
yeah,
thought of these use for acupuncture is exceptionally interesting. So, can
yeah.
you clarify the difference between type 1 and
Mhm.
type 2?
Okay, what's the type 1, your body no longer can produce the insulin, so you have to use external insulin. So what happens is your body confuses the islets of Langerhorn, the beta cells in there that produce insulin. And, actually, I'd gotten it right after I thought I had the flu. So the body thought that those uh, beta cells that produce insulin were something that it had to attack. So it killed off all my beta cells in the pancreas. And so I can no longer produce insulin. So the but now my body can utilize the insulin that I take a lot better, and it can keep it stable. Now, type 2 diabetes, your body can still produce insulin, but it can't utilize the insulin. So a lot of times they'll give you drugs, oral drugs to help your body produce more insulin, which kind of works up into a point where until the pancreas just kind of is overworked and it can't do it anymore. And that's typically what they'll see with type 2 diabetes is they have to keep on pushing that pancreas harder and harder to make it produce more and more insulin. And then, but you can, and we can help with that too. That's actually easier to treat because um, we can help the body utilize the insulin better because and people get allergic to their insulin when we're muscle testing. That's what we find. So if, having more of if you're eating a lot of sugary type things, a lot of carbs, your body overproduces the insulin, and actually it stimulates the body to produce more fat tissue. And so it's a whole, what they call syndrome X. So I guess that's a whole seminar in itself. But we can help with the type 1. I don't think anyone's been able to help people produce, you know, beta cells again so they can produce insulin, but we can help the body utilize insulin better. And that's really important if you have type 1 diabetes because, if it's not being utilized properly, then your blood sugar's all over the place, and that can be dangerous. I don't know. Probably, hopefully, we answer that question. um, any other questions? Okay, so we'll go to our. Anyway, so I've lectured quite a few places and told you about the NAET, which we use extensively in combination with the acupuncture here. And we're going to learn more about the acupuncture. So, what is acupuncture? It's actually energetic medicine. So, the vital energy or chi, the life force, circulates through the body through these meridians. And, people were confused because when they do autopsies, they go, we can't see any meridians here. And we'll get to that a little bit later. But the whole idea, of course, the ancients, they theorized this based on observation, and they were really good observers. And so they charted out the meridians and the paths of the energy and what parts of the body they affected. And um, so it's kind of like, if you think we're like plumbers, we have all of these meridians in our body. If you get a blockage, then it'll stimulate a deficiency on one side and excess on the other. And if you don't have proper circulation, then you'll have in these meridians and you'll have disease will result. So as long as we keep things moving and circulating in balance is the whole thing with acupuncture. Okay, so modern research has shown acupuncture to increase the body's resistance to disease by stimulating the immunologic, neurologic, hormonal, metabolic defense activities. Today, this ancient theory has been researched in numerous countries around the world and shown to be based on scientific fact. Okay, acupuncture stimulates the body's natural healing systems. And you can tell everybody, how acupuncture works. It basically stimulates our own natural healing system. So that's the easiest and most accurate way to describe it. But if you want to break it down a little bit more, the three main mechanisms of its action are: number one, neurological, it works through the body's nervous system; number two, the body's biochemical system. So the body produces a lot of uh, its own chemicals and hormones. And just one example, we know that someone has low back pain. Uh, okay, so a lot of times the body, as a defense mechanism, will tighten up the muscles in the area. Okay, when
Hmm.
you tighten up the muscles in the lower back, then you get more pressure on the nerves, and also the spine, and so you get more pressure on the nerves, which causes more pain, causes more muscle tension, and so you don't get proper circulation of the nutrients or the oxygen, and the whole healing process slows down, tends to get worse. So the acupuncture helps to relax the muscles, and they've learned that it actually stimulates the body's own natural cortisone that doesn't have bad effects, that has good effects, the natural cortisone, and takes the inflammation, a lot of the inflammation out, and then it can kind of speed up the body's natural healing system. So, fortunately or unfortunately, acupuncture doesn't just block pain. The only time when you can block pain is when it's used acupuncture anesthesia, and that works. They're using it on operations. They can do operations. When I was in China, I saw a craniectomy, a thyroidectomy, and a cesarean done with acupuncture anesthesia. So you can do that, but it's temporary. After you take the needles and the electrical stim off, 15 minutes later, the person, that normal feeling will come back. So the people respond faster and they actually heal better because you get some negative effects from the artificial pain relievers, or, when they have to do an operation there. Okay, so we've got neurological, biochemical, and third is bioelectrical. So I did my doctoral dissertation on bioelectricity and acupuncture. So this one is fascinating to me. But they know that, like on frogs and rats, they've been able to cut limbs off of frogs and rats and actually stimulate them to regrow their limbs, putting a very small negative voltage at the stump. So on frogs and rats, we can do this. We haven't been able to do this on people. So, but we know, and the good doctors know that if a, a child younger than 7 years old gets his finger above the first joint cut off, they won't try to sew it back on because they know it'll automatically regrow if he's younger than 7 years old, and actually regrow it better than if they try to sew something back on there. So that's interesting. As we get older, we lose some of that natural bioelectrical energy. So the acupuncture helps stimulate things. And I think that's pretty interesting. Okay, so how does it stimulate the body's healing system and immune system? Um, okay, so the effects of acupuncture are delivered by neurological, biochemical, and bioelectrical mechanisms. Um, and this article is referenced uh, if you go to our website, it's, let's see, Dee Kendall's article, so it's reference number 14. And anyway, he actually was my doctoral dissertation advisor. So he could explain everything about acupuncture without any meridians. So he had all the neurological and biochemical he could explain it perfectly. So like an MD is gonna go, oh, okay, well that's how it works. Yeah. So anyway, that's a good article to get a hand of. Um, and and we know that the neurological, this is kind of simplified, the A delta and C fibers carry signals into the spinal cord and upward to the brain. The importance of the fibers, in addition to mediating acupuncture, is the connection to the internal organs through the dorsal horns of the spinal cord. There's three references there. And then the biochemical, many bioactive substances, including bradykinin, histamine, leukotrienes, are important for initiating responses at the acupuncture points. The serotonin, enkephalins, endorphins, and substance P are important for mediating the central nervous system effects of acupuncture. Okay, and maybe to me more interesting is the bioelectrical, is the natural energy naturally occurring in the body has been found to stimulate regeneration and healing. And like I said, the limbs of frogs and rats can be regenerated, and resistant bone fractures were healed in humans by electric treatment. So they have devices now that if someone's, like if their femur is broken, that's their leg bone, and it has a hard time healing, they can put on coils to stimulate electrical current, in the bone, and that will stimulate the healing and get it healing faster, like it should. Okay. And also, they did studies where they would inject radioactive isotopes into the acupuncture points, and they found that it migrated along the meridian. So it didn't go along a nerve, it didn't go along a muscle, it migrated right along where that meridian is supposed to be. And so that was interesting. And you can also, with an ohm meter, which is measures electrical resistance, you can find the acupuncture points because they have lower electrical resistance. So we're going to talk a little bit more about that
Um,
too. Yeah.
mm,
Yeah, we got a
Dr.
question. Yeah.
Crosscheck, those biochemical, is that like would it help with allergies and sleeping patterns?
Yeah, we know that we can help with sleeping problems in acupuncture. We know that basically we have two different types of sleeping problems. One is the trouble falling asleep, and the other is staying asleep. So both of those, they affect different meridians, we know, but we can help usually with both of those. Yeah. And let's see.
Thank you.
And we saw this, can this help with people with Parkinson's symptoms? And yeah, we have helped a number of people with Parkinson's and some of the problems. Well, specifically the tremors, sometime we can reduce a little bit, but a lot of times they'll have problems with dizziness and, well, balance, sense of balance. So sometimes we can help with that too. And, uh, okay. Uh, okay, so here we're looking at like a side view of the body with the meridians. So you can see the right arm is up, and those meridians on the inside, kind of like the greenish up there, is the yin meridians, and the red, like on the leg and on the arm, those are the yang meridians. And so the yang meridians start at the fingertips, travel up to the head, connect to the yang organs, and then to the toes. The yin meridians start at the toes, travel up to the yin organs, and down the arms to the fingertips. So it's like a complete circuit. If you have somebody, electrician, he's going, that looks like circuits in the body. So, and actually, that's what it is. And then, oh yeah, other benefits. Yeah, so we know that acupuncture can help stimulate the healing from things like common cold, and one of the common colds thing is a coronavirus. But and then also with the other one was done with influenza. So we know that it helps the immune system. And how does it help? It stimulates the body's natural healing systems. And you know, there's a lot of information in the literature about that, but we know that it can stimulate. There's the immunoglobulin 1 and immunoglobulin 2, and the immunoglobulin 1 sets off the attack mechanism of the body, and the immunoglobulin 2 kind of helps after the bugs are pretty much dead and to kind of calm things down and go with the healing part. So it helps with both the immunoglobulin 1 and 2. And where it says treatment of choice for lumbago, and actually that was the father of modern medicine. Like uh, he actually mentioned that uh, as the treatment of choice for lumbago. So this was like in the many years ago. But actually, the uh, let's see, Medicare, yeah, Medicare did a kind of like a study to find out if acupuncture could be helpful for low back pain. And so they actually stopped it in the middle because it was obvious what was going on. And so they right away, which they'd never done before, we're not even providers under Medicare. They said that they would pay for it for low back pain. But since we're not providers, we can't bill for it. So it gets complicated. So if there's an MD who bills for it, we can do it and get paid. But anyway, I think they'll get this all figured out because they figured it can help with a lot of other things too. So that's just kind of ongoing, and it's hopefully within a year or so that'll be figured out. Let's go with the next slide. And this is just kind of pictures of the picture on the left is the meridians just over the torso, going down the front of the body, and the one on the right is the back of the body. And the one in the center is the Ren channel, and just lateral to that is the kidney channel. Then we got the stomach meridians, and so you can see it's all spaced out because I mean the meridians, below and above there, they don't stop. They go like they go on, and if you like up here, it goes internally from at the top in the center. So there's internal connections also. Yeah. Next slide. And here's another picture, front and back of the body. And this gives you an idea of one of the major concepts in acupuncture is of yin and yang. And so we know that everything is about balance. So yin is the kind of the dark, calm aspect, and that deals more with the sympathetic nervous system. And if we don't have enough energy, that's a yin type thing, and that can lead to degeneration. Okay, the yang is kind of the light, the active, um, and that relates with the sympathetic part of the nervous system. And when that gets really too much, then you have inflammation. So you can see you want to have the correct balance in the body. And, our body can switch between sympathetic and parasympathetic, but you don't want it to be out of balance in either way. So, yeah, so you can think of acupuncture as keeping the energy moving within the meridians and not having too much energy or not enough energy. That's and this is kind of interesting. We know that some of the most powerful points, the most commonly used points, are below the elbows and below the knees. Here's we show below the elbows and on the palmar side. Um, well, we've got the heart meridian, the pericardium meridian, and then the lung meridian is kind of there by the thumb. And on the dorsal side of the arm, you have the large intestine meridian. You've got the triple warmer meridian on the ring finger and little finger. You've got the that's a small intestine meridian. So yeah, and we'll go next slide. And this kind of goes into more the NAET, and yeah, it stands for Nambudrapad Allergy Elimination Technique. And this is one of the techniques that we use at our clinic. And you can see, yeah, I think I mentioned about Dr. Devi. Did I mention that about her before? I think I might
Mm,
have. Maybe not.
Doctor,
Hmm.
would acupuncture help with carpal tunnel?
Oh, yeah. Hmm. Yep. And we see that actually it's a frequent one. And we've even seen it sometimes had a patient, they had two carpal tunnel surgeries done. So they had both wrists done at the same time, which I can't
Mm,
imagine them doing that because the person can't
mm,
use their hands for, but actually in after the healing time, they still had carpal tunnel afterwards. And in that case, it was coming from the neck, which they should have picked up on. But what happens is you can have sometimes it's due to fluid retention in the body, and that creates um, like pressure on the wrist area. And the carpal tunnel is in there. So when you put extended pressure on that for a length of time, then you can get numbness and pain, going into the hand, going into the fingers. Um, so, uh, and actually, the inventor of carpal tunnel surgery, years afterwards, he found that if people um, took uh, and you definitely, if you have carpal tunnel, you want to talk to your doctor about this. But if used enough B6, you could actually reduce the carpal tunnel, and a lot of the carpal tunnel surgeries wouldn't have to be done. And that's because the B6 actually helps your body get rid of extra fluid. Um, and so if you get rid of the fluid, that's one of the things that can cause pressure in the wrist and pressure on those nerves. Of course, you can do it from doing the same maneuvers. People work in factories, they're doing the same maneuver over and over, and that can lead to carpal tunnel too. Or, we see a lot of people, they get carpal tunnel on their hand that they're doing their mousing. And so that's, uh, we see quite a bit of that. Um, okay, and yeah. So anyway, yeah, we do a lot of the NAET, and we use that in conjunction with the acupuncture. We get really good results. And yeah, one of the problems nowadays is they're putting so many chemicals in our foods, of course. And a lot of times people will become sensitive to some of these chemicals. And I always like to mention that the farming industry now, they actually put another chemical with their pesticides so that the rain won't wash it off, which is good for the farmers, not so good for us. If you're just used to rinsing it off with water, it no longer will rinse off. So you have to use some solution to make it water soluble. Some people use vinegar. Some people, you can go to the health food store and they get a special spray, and you just spray it on, and then you can rinse it off, and it allows the pesticides to be water soluble, so you can wash it off. Oh, okay, I see. Is doctor accepting? Actually, we kind of get booked up a little bit sometimes, but um, we do have a couple other acupuncturists in town, Mark Crapo and Ian, too. So they're in town, and we do get, uh, you know, sometimes you have a little bit of waiting, but if you can wait, we'd be happy to see you. If not, there's a couple other people too. Um, so yeah, we definitely want to not consume more pesticides than we definitely have to. And so it's good to get as much organic as you can, and uh, try to avoid as many chemicals as possible. Okay. Okay. And let's see. So, yeah, we have actually, it's our Kalamazoo clinic now is accepting vets. They would just have to go through this technique of contacting their VA doctor, and then their doctor review the conditions, and they can determine their eligibility, and they can then get referred. And our Kalamazoo clinic is taking uh, the vets. We haven't signed up for it here. We're trying to handle as many of our regular patients as we can, and uh, we're waiting for another acupuncturist to help help us out too. And at that point, we'll be doing that also. And let's see. Do you have associations or references in other states? Yeah, and let's see. For actually, there's a lot of uh, references. If you just Google acupuncturists in North Carolina, that's, and we always recommend that you call the acupuncturist and just ask him if he's had experience with this problem, and how he does with it. And um, usually it's it gives you kind of an idea if you can communicate with that doctor well enough, and that's what we recommend. Yeah. So let's see, we can and there's our clinic and our references, and we have our Kalamazoo clinic too. And there we are. And I just want to make sure we had plenty of time for everybody to ask questions. And I can talk a little bit more about any of those subjects. We do quite a bit of actually on the scientific basis of acupuncture. The reference number 8, um, it's from the World Health Organization. It's Acupuncture Review and Analysis of Reports on Controlled Clinical Studies. So, um, if you're skeptical about, them doing research, well, if you just Google acupuncture research, you'll just get filled up with a lot of references. This has a lot to do with a lot of really good controlled clinical studies, and they kind of rate each one and give more information. Oh, want to go back to yeah, I can go backward here. We'll go. Yep, there we're at. So we're in the Oak Ridge Office Center. We're in the front building, and there's only one like single story, and we're in the single story building in the front. And so if you just kind of walk into that picture, just a little bit to the right, the door's right there. Yeah, it's kind of a large complex, but we're easy to get to because we're right in front. Yeah. And let's see.
Does this help towards obesity?
What was that?
Can you use acupuncture for weight management?
Oh, yeah. Hmm. Yeah, we've
When
treated a lot of people to help with that. And a lot of people, if they're craving sweets or chocolate or salty foods, and some people, well, we kind of work on the conditions. A lot of times we find out something called candida, which is unfortunately, um, you know, a lot more people were thinking that it's healthier to eat a lot of carbohydrates, and it's real easy to pick up candida and or parasites. Fortunately, people think, well, we're not a third world country. We don't have parasites here, but we do, and we find them on people all the time, and especially in springtime because people are working out in their gardens, and but you know year round it's kind of a thing. And actually, they love uh, people who are eating a lot of carbohydrates. So there's, in fact, they'll make people crave salty foods or breads. And we know that, using um, uh, the acupuncture and the NET, we can help people get over that. Let's see. And so gaining weight is not always, a problem with fungus, but sometimes it is. And what we tend to see is people who are having trouble losing weight. It's like they've tried just eating less and that's not working. And it's kind of like their metabolism's been slowed down. And, the candida type of thing, the fungal infection or candida. Candida is one particular type of fungus. And anyway, uh, they're we've seen it so bad that some people, because they're robbing all of your good nutrition, so they're gobbling up all your good nutrition and nutrients and giving you toxins in return. So some people get migraines or something from just having the candida and fungus. So we try to work on the underlying problem and correct that. And so people notice, oh, well, I have more energy now, and I can, then you're more active. You feel like doing more. And so that's how we like to uh, work at the kind of root cause of the problem instead of just, you know, just covering things up with a band-aid. Yeah. And let's see. So, yeah, and acupuncture has been used worldwide for, many years and like for centuries. So some people think, oh, well, this is like a new thing. And it's actually, Western medicine is kind of like a new thing. And acupuncture has been used a lot longer consistently. And yeah, when I went to China, it was through a program by the World Health Organization. And in my opinion, that was before they got a little bit too off base with their politics. But anyway, we know that, you know, I thought the Chinese people were really, um, really nice. And it's kind of the Chinese government that might not be the nicest people around. They tended to keep, if a couple was married, they would almost always, it seemed like, have them in different cities. I'm not sure what the strategy with that was, but anyway, the people were really nice. And yeah, let's see. Does it work for anxiety, and how does it work? Yep. And one of the kind of side effects people notice is when on their on the table, it's like they'll either really relax or fall asleep during the treatments. Okay, so we know that when the body is out of balance, you can have too much of the sympathetic nervous system activated. Okay, and for some people, this is they're kind of used to just always multitasking and doing everything, and maybe their digestion's not that good because actually the digestive system requires you to be in the parasympathetic mode. So if you're multitasking and doing a lot of things and trying to digest your food, it just doesn't work. But we can kind of help balance things out. So your sympathetic and parasympathetic is more in balance, and that's like balancing the yin and the yang. So people, they can focus, good attention, and actually their focus is better because when they're all anxious, it's hard to focus, you know. But if when you're clear, focused, and calm, you can be a lot more efficient. So sometimes we have people coming in to stop smoking, and these kind of executive type people, and they wake up and they're going after the treatment. It's like, oh, they found out they could do their job a lot better. So, they just come in, maybe every other week, come in for a booster and just, so they can be more efficient at work and feel better. And, of course, stress is one of the major causes of most diseases, too. So, um, okay, then another question about for hormone balancing. Yep, and we do a lot of work with that. And like women, when they're in like perimenopause or menopause, they'll get the hot flashes, and we work on that. And of course, the whole hormone system in the body that affects men and women too. So sometimes people just aren't, they don't have much energy. So we work on the hormonal system, but also some people, they're just not producing, from the food they eat, they're not producing their energy. So we can help with digestion too. So the body in the digestive system is producing more energy. Yeah. And actually, I should probably um, mention my problem with acid blockers. And we know that acid blockers should, you know, not be used for extended periods of time. Of course, talk to your doctor, but um, the correct use is temporarily if you have like, an ulcer anywhere in your esophagus and your stomach. Um, the an ulcer is caused by a bacteria, so they would have to use some antibiotics and then put you on an acid blocker for a specific period of time so things can heal there. But if you need acid blockers all the time, what happens, your body needs to digest minerals, and um, you need the correct hydrochloric acid to digest minerals. So if you're using acid blockers, it's you're going to make sure that you don't assimilate your minerals. And we know that as we age, we produce less hydrochloric acid. So what happens, the food goes into the stomach and it doesn't digest, so it sits there. Now, when the pH goes to a certain level from your hydrochloric acid, it signals the body to move it along. But if it sits and ferments and putrefies, that little valve doesn't open because it isn't the right sensing mechanism to open it up. So it'll cause gas and open up the valve at the top of the stomach and come up on the throat. We've had people chronic cough and even chronic sinusitis because they're getting the acid reflux. And some people are not even aware that it's happening too. So, um, it can be very uncomfortable, or some people don't hardly notice anything. So, anyway, if we can kind of heal the system and help. So sometimes we have to use some additional herbs so you can digest properly without the acid blockers, and help things so you can continually digest your minerals so you can keep your bones in good shape. And so, they say that a lot of these, when people break their hips, it's not that their hip breaks and they fall, it's that um, it's not that they break their hip because they fall, because it breaks first and then they fall. Because the hip bones can dissolve just like that. So anyway, yeah, it's important to get the proper balance in the whole body, things digesting, you're getting your energy, and that getting transported to every part of your body. And like I said, we do have a really good stop smoking treatment too. It's just 2 consecutive days, and we've been, I think now, probably better than 85%. Um, and it seems to help people. We had one lady, and she said that she had tried everything, and she was so glad after second treatment. She just knew she didn't have to have any more cigarettes, and she'd had one lung removed, so we knew it wasn't a motivation problem. And but it is, the nicotine is a very powerful drug. And of course, we know 12 years ago, uh, around there, the tobacco companies hired scientists to add extra chemicals to make it more addictive. And so, we've had people say, "Oh, well, I quit like 20 years ago, but now, I can't quit. I don't know what it is." And well, guess what? It's those scientists did their job so well that it's a lot harder to quit now. Yeah. And so it's good to have a well balanced diet, and avoiding a lot of processed sugars and carbohydrates. And unfortunately, there's research, if you look now, that actually the cholesterol theory was kind of paid by the sugar industry. So that gets into a whole other thing that now, even I think it was Time Magazine that initially published an article on cholesterol theory. They kind of came back and said, "Oops, sorry." And the scientists who kind of, after they did studies, finding that the cholesterol consumption was not the cause of heart disease, that now they're determining that it's more from inflammation, and inflammation is caused by carbohydrates. So that's kind of interesting, and you can Google information on that, and it's pretty interesting stuff. And let's see, yeah, something, I don't know if you want any current events, but in all this information, it shows that I have. It used to be, we used to be registered in the state, but now, as of a couple months ago, now we're licensed. So it will be affecting insurance in the future, and we have our state organization is working towards that. With federal workers, the Blue Cross Blue Shield Federal also has their standard, and that does cover 20, I think 20 policies a year. But you can check with for your particular um, insurance, and just double check that. But I think more and more of the insurance companies will be covering acupuncture. It's always good to call them and kind of push them along a little bit too. Uh, you know, the the healthcare, unfortunately, in this uh, country is more like disease care, and we can help with disease care, and we can also help people with with health care. That's what we like to do too. And so that's our, in ancient China, the acupuncturists will only paid as long as their patient stayed well. Okay, so if they got sick, they weren't paid until they got them well again. So the emphasis, they didn't want their patients to get sick. So they found out ways of prevention. So, we do something called muscle response testing, and found that really helpful. And also learned in our schools, learning by checking the pulses and the tongue, examining the tongue, getting information, so we know it's not just uh, disease. We want to keep people kind of balanced, and so if you can keep people at optimum performance, that's our goal too. Yeah. Okay. Well, um, I guess it looks like my little timer is almost going off there. If there's anything else, oh, okay, from trying to recover from major surgery, we've helped a lot of that too. And also even before people go in for surgeries and to recover faster. Okay,
We
so,
have about probably 9 more minutes.
oh,
I
okay.
know we started the timer early.
Oh, okay.
Um, is there any more questions? Please, you can either type it or you can unmute your phone and just ask your question. That was
Hmm.
perfectly fine. We have a few more minutes, so
Hmm.
go ahead.
So one question I had, this is my name is Place. I'm from Battle Creek here.
Hmm.
Medicare usage for treatment, is that uh, possible, or has it got to wait for some of the licensing stuff to proceed further along? How does that work?
Yeah, Medicare's kind of like, well, Medicare will be, um, in the future, we believe we'll be covering it. But in some of the like priority health, some of those they say they cover it, but they haven't started quite in Michigan yet. So the licensing, we turned over from registration to licensing just like within a past few weeks. So the blues have not really um, come onto it. Although I think some of their policies may cover it. And I know that the federal um, Blue Cross Blue Shield standard um, does cover it. We give you a super bill and you go home and put on the computer and you get reimbursed for most of it. So uh, that's the way that works. But the standard Medicare, Medicaid, I think right now, supposedly they cover low back pain, but only if it's billed by an MD. So that's kind of strange. So the acupuncturist does it, and then it's billed by an MD. So I don't know if anyone in Battle Creek who is doing that right now, but um, I think they'll get it figured out because they know that we can help out with a lot of other things too. So,
All right, sir. Thank you.
hmm. Okay. Well, and yep, if anyone at any point has any other questions afterwards, you can always call our offices, and uh, you know we like to answer questions there too. And check out our website because that has a lot of good information. We know that the scientific basis of acupuncture has a lot of good good references on it, and some of the things I talked about. Actually, the actually I didn't mention it, but they found out actually that these meridians are actual structures. They found out if they injected a special type of dye, and then into an animal and then sacrificed the animal, they could see these meridians. Okay, so now that they can see them, the unfortunate thing is they're very thin and they're transparent. So unless you use the dye, you don't see it. And so now they're kind of discovering that there's a whole new circulatory system in our body that they completely, we have all of these scientists who think they know everything about the body, and now they're going, okay, well, we kind of missed that. And they found out that the meridian tissue actually conducts electricity and also light energy. So we have photo optic cables in our bodies. So um, that's kind of interesting too, I think. And I would think that there would be like announcements on CNN, Fox News, but of course it doesn't really make anybody money. So, there's not much research on that. But I think that they, I don't know how they're getting away with not doing any research on there. Yeah. Okay.
Thank you so
Well,
much,
I would like
Dr.
to.
Kravchuk. Sorry, you're always a wealth of information. Thank you so much.
Yeah.
And Martha, could you make sure that the slides are available to us?
Yes, ma'am.
Again, thank you,
Will
Dr.
do.
Okay.
Kravchuk,
And
and thank you.
reference number 18 on that scientific basis of acupuncture is the one where you get to see actually the little picture of the meridian. So
Very
gotta
interesting. I
get there.
appreciate that.
All right. Thank you.
Well, I really appreciate you coming over and talk to us about acupuncture.
Mhm,
We will have these available, and
mhm,
I really appreciate you very, very much. Really good topics um, and information on acupuncture. Thank you
mhm.
very much, Dr. Perfect.
Okay. Well, thank you so much too. Appreciate that
Thank
opportunity.
you, Dr.
Thank you.